today I'm going to be talking about OTC Pain Management. This is created by me and another Stanford Pharmacy student, Paola. So, first, we're going to be talking about acetaminophen, NSAIDs, combo products, topical products, and then basically comparing Tylenol to NSAIDs. So, first, I'm going to talk about Tylenol. So, essentially, Tylenol relieves pain and reduces fever, but does not reduce inflammation. It has no anti inflammatory effects. It is safe for people with stomach issues, but it can cause liver damage if you're using doses above 4,000 milligrams per day. It does not cause stomach irritation, ulcers, or bleeding. It does not have an increase. It does not increase your blood pressure or your heart attack risk, and it is effective in lowering fevers, often recommended for children. So, here are some of the common NSAIDs that you'll see. So, we have ibuprofen, naproxen, aspirin, and diclofenac. So, ibuprofen, also known as Advil, that's going to be your fastest onset and it's good for your general pain and fever. Naproxen, also known as Aleve, that's going to take longer for you to get the effects of it, but it's going to work longer than ibuprofen would. So it's better for patients that have chronic pain. Aspirin, it has blood thinning properties and it has good cardiovascular benefits, especially in patients that have had a previous cardiovascular event such as stroke or heart attack. Diclofenac, this is a topical formulation, also known as Voltaren. It is good for arthritis and it is a good source because it targets the direct area of pain because you're applying it to like your knees, places that are affected by arthritis. So here is a chart that basically compares ibuprofen, naproxen, aspirin, diclofenac, what they're used for, how long they last, how often you dose them, GI risks, cardio risks, and what they're best used for. So as you can see, ibuprofen is dosed more often than naproxen due to it being a faster onset, and naproxen lasts longer. So, also best use general pain fever for ibuprofen, arthritis, chronic pain with naproxen, heart protection, mild pain for aspirin, and arthritis slash post surgical pain for diclofenac. So, next we'll talk about some common combo products that are seen. So we have goodie powders. This is going to contain acetaminophen, aspirin, caffeine. In as the name would suggest, it is a powder formulation, so not your typical tablet or capsule that you usually see. Then we have Etc. Migraine, which contains acetaminophen, aspirin, caffeine, and it is a tablet. Then we have dual action Motrin, which is going to be a combo of acetaminophen plus ibuprofen. So it is a combo product, a good thing compared to just taking it separately. It's good because, like I just said, you won't have to take multiple pills. You can just take one and you'll get both those effects. Unfortunately, sometimes people don't realize all the ingredients in there, so you could have an accidental acetaminophen overdose by combining multiple products that contain acetaminophen. And then aspirin in general is just not the best NSAID for pain relief or fever reduction. And as I mentioned, the two products on the left both contain aspirin. And then if you are constantly overusing these products, it can actually lead to worsened pain. Next, I want to talk about some of the topical products that you'll probably see over the counter. Lidocaine, capsaicin, menthol, and methyl salicylate. So lidocaine is just going to numb the area. It is going to give you fast relief and localized pain if you have things such as nerve pain. Menthol is going to give a cooling sensation that will distract you from the pain. And methyl salicylate is going to help with inflammation and pain, usually used for muscle aches, back pain, arthritis, and sprains. Capsaicin, this is derived from chili peppers and is effective for nerve pain, and it's one that you're going to have to use for a good 1 to 2 weeks before you'll actually see an effect. And because it's derived from chili peppers, you want to avoid touching your eyes because it can burn. So basically, Tylenol versus NSAIDs. Basically, the big thing is Tylenol has no anti-inflammatory effects. Next, Tylenol is going to damage the liver, whereas NSAIDs would damage the kidney if they are overused. They are both effective in treating mild to moderate pain and reducing fever. Some NSAIDs, aspirin specifically, has a blood thinning effect, and you can alternate Tylenol and NSAIDs, but you don't want to combine an NSAID plus an NSAID, but that can increase your risk for GI bleeding and side effects. Tylenol is also gentler on the stomach, whereas NSAIDs have a higher risk of GI bleeding and stomach upset. And then in this picture here, it shows dosing differences, formulation differences, such as tablet, capsule, liquid. And Tylenol has tablet, capsule, liquid, and a rectal suppository. And also on there, it says that you can alternate them and how often you take them. So, in conclusion, Tylenol has no anti inflammatory effects, preferred for patients with kidney problems. It's easier on the stomach, good for mild to moderate pain and fever reduction, and you want to make sure you're not exceeding that 4,000 milligrams per day. For NSAIDs, that will give you your anti inflammatory effects. There is potential for GI bleeding and ulcers. It's good for patients with liver problems, effective at mild to moderate pain and fever reduction. And then aspirin can provide a cardiovascular benefit. And then your topical products, again, lidocaine, fast numbing action, capsaicin, you're going to wash your hands after use because of it is derived from a chili pepper. And then it will take 1 to 2 weeks to get that relief that you're looking for, and it's good for nerve pain. Menthol is going to give you that cooling sensation. Methyl salicylate, good for muscle aches and pains. All right, that's all I've got for you today. Thank you for watching. If you have any questions, let us know, and we'll see you next week.